are providing only 20% video as a part of promotion. For remaining 80%, that is 6 to 8 articles, current affairs video and general studies complete videos, please subscribe to our complete package. 1. Suspected links between the Zika virus and two neurological disorders, microcephaly in babies and Guillain-Barré syndrome, should be confirmed within weeks, the WHO said. What is microcephaly? Why Zika is suspected to cause microcephaly? What might be the other possible causes for microcephaly if the Zika is overhyped? What is pyriproxyfen? Do pyriproxyfen really has a link with microcephaly? Why is it a public health emergency? What is microcephaly? It is when a baby is born with an abnormally small head, as their brain has not developed properly. The severity varies, but it can be deadly if the brain is so underdeveloped that it cannot regulate the functions vital to life. Children that do survive face intellectual disability and development delays. It can be caused by infections such as rubella, substance abuse during pregnancy or genetic abnormalities. Why Zika is suspected to cause microcephaly? Brazil had fewer than 150 cases of microcephaly in the whole of 2014. But more than 4,700 cases have been reported since the 22nd of October 2015, with 404 confirmed and 3,670 still being investigated. The link with Zika has not been confirmed, but the WHO says it is strongly suspected. Some babies who died had the virus in their brain and it has been detected in placenta and amniotic fluid too. There have been suggestions that Zika led to a rise in birth defects after the 2013 outbreak in French Polynesia. What might be the other possible causes for microcephaly if the Zika is overhyped? Latin American doctors have come up with an alternative explanation, that a pesticide, pyriproxyfen, was introduced into the drinking water supply in 2014. This report from an Argentine doctors' organization has challenged the theory of Zika virus causing microcephaly among newborns in Brazil. Malformations detected in thousands of children from pregnant women living in areas where the Brazilian state added pyriproxyfen to drinking water are not a coincidence. The report adds that the Brazilian Health Ministry has failed to recognize that in the area where most sick persons live, a chemical larvicide producing malformations in mosquitoes has been applied for 18 months. What is pyriproxyfen? Pyriproxyfen is used in a state-controlled program aimed at eradicating disease-carrying mosquitoes. Pyriproxyfen is a growth inhibitor of mosquito larvae, which alters the development process from larva to pupa to adult, thus generating malformations in developing mosquitoes and killing or disabling them. It acts as an insect juvenile hormone or juvenoid, and has the effect of inhibiting the development of adult insect characteristics, for example, wings and mature external genitalia, and reproductive development. Do pyriproxyfen really has a link with microcephaly? Pyriproxyfen is a relatively new introduction to the Brazilian environment. The microcephaly increase is a relatively new phenomenon. So the larvicide seems a plausible causative factor in microcephaly far more so than GM mosquitoes, which some have blamed for the Zika epidemic and thus for the birth defects. There is no sound evidence to support the notion promoted by some sources that GM mosquitoes can cause Zika, which in turn can cause microcephaly. In fact, out of 404 confirmed microcephaly cases in Brazil, only 17, 4.2%, tested positive for the Zika virus. Why is it a public health emergency? The World Health Organization is worried that Zika is spreading far and fast, with devastating consequences. Declaring Zika as a public health emergency of international concern singles the disease out as a serious global threat. It puts it in the same category of importance as Ebola. Unlike Ebola, where the focus was on boots on the ground, with Zika the attention will be on understanding the link with microcephaly. The WHO will coordinate countries' health agencies to conduct trials to determine the risk. It will also encourage efforts to stop the mosquito that spreads the disease as well as finding a treatment or a vaccine to stop the virus.